You have to sedate a patient to do a colonoscopy.
Why? Just because of the pain? If you find a tumor in her colon, you can knock her out. If you don't, she stays awake.
It hurts. She's bleeding.
Oh, to be honest, I don't know why she's finding this procedure so painful. Colonoscopy can be uncomfortable, but not screaming at the top of your lungs pain. Although, you know, it is a medical drama, they have to add a little bit of extra spice. I understand.
What'd you do?
I just wanted to sleep.
I'm calling an ambulance.
Wait, what were those capsules called? Royal Knockout Sleeping Capsules. That medication had never existed. So they printed a custom label for that so we could know what it was just from a short shot of it. That's commitment. I wonder how many tablets she took. Zopiclone is one of the safest sleeping tablets, and there have been reports of fatal overdose with just 15 of them. So this would be pretty serious since she took a whole bottle. At least she's still conscious though, so she's probably found quite early. The question is though, why did she overdose? Did she really want to sleep, or did she actually want to end her life? If it was just a sleep, then why was she so awake in the first place? What could cause such intractable insomnia? To be honest, there are lots of causes of insomnia like that, like recreational drugs, heart failure, anxiety, depression, arthritis, Parkinson's disease, and the list goes on and on. But we're not excited by those in-house episodes because we want rarer things. And some rare things are things like Morvan syndrome, which is a progressive encephalopathy due to autoantibodies to voltage-gated potassium channels, or even fatal familial insomnia, where a genetic abnormality causes your body to build up prions that knock out your thalamus and keep you awake until you die. Now, if it's that would be spicy.
You've seen one patient in the last 2 hours.
Complicated case.
Okay, I'm not proud of this, but I remember when I first qualified, I was on one of my first ever night shifts in A&E. Nature called at around 2 a.m. and my sleep deprived body decided to shut itself down in the act for about 40 minutes. The bleep that woke me up will forever haunt my dreams.
She hasn't slept in 10 days.
She's lying. Without REM sleep, your neurons start regenerating. The brain shuts down lobe by lobe. She'd be insane after 5 days, dead by 10.
See, sleep is very important for the brain. It helps filter out beta amyloid, which is basically a toxic protein that can lead to Alzheimer's disease. It aids muscle recovery, maintains hormone balance, helps us form new memories, links, and has countless other functions. At 24 hours without sleep, you get drowsiness, irritability, impaired concentration. At 3 days without sleep, you get delusions, disordered thinking, depersonalization. You don't feel like yourself anymore. There aren't many studies in humans that explore beyond 3 days, but there was actually a world record attempt in the 1960s by a guy called Randy Gardner, who stayed up for 11 days and began hallucinating. Had to end the attempt early. The longest recorded person to go without sleep is Michael Cork, who had the condition I mentioned at the beginning, fatal familial insomnia. He survived for 6 months without sleep. It starts with insomnia, then hallucinations, weight loss, dementia, and finally death. Hopefully Our Lady won't have this.
25-year-old female hasn't slept for 10 days.
Schizophrenia?
No delusions. Aside from the sleeping pills, tox screen was clean. No cocaine, methamphetamines, or diet pills.
Okay, surprise, surprise. It's not recreational drugs. I swear it's never drugs when we actually think it is. Also, was surprised to hear that even after her overdose of the whole bottle, she was still awake. That's concerning. The team have been mentioning sedation, but sedation and sleep are two totally different things. If you've woken up from sedation, you know you feel drowsy, uncoordinated, and some people can even hallucinate. If you've seen the videos of people waking up after sedation, they are hilarious. Take a look.
Who are you? What's your name?
My name's Candace. I'm your wife.
You're my wife?
Yeah?
Holy shit!
Of course, when you wake up from sleeping, it's not quite the same.
Let's go back to the beginning.
How far back?
Genesis. God said, let there be light.
Sleep is initially controlled by external light cues.
And if her brain can't interpret those cues?
Optic nerve disease.
See, this doesn't quite actually make sense, and I'll tell you why. Because the optic nerve senses light, and the light actually suppresses a level of melatonin, which is a hormone that regulates our sleepiness. Low light means high melatonin, and high melatonin means being very sleepy. So if her optic nerve is not sensing light, then actually it should be helping her sleep, not hurting it. It's not her optic nerves.
Negative for optic nerve disease.
But she sleeps.
For like 10 seconds, maximum 1 minute.
Whatever this woman has, it's not showing up on our tests, which means she's sick. Just not sick enough for us to see it. I want to stress her body, keep her awake.
How is he gonna do this? She's already only micro sleeping after 10 days. Is he gonna give her stimulants? Hold her eyes open with clamps? Trust me, after 10 days without sleep, you could give me 10 cups of coffee, clamp my eyes open, and I would still find a way to sleep, even if you injected me with Class A drugs directly into the vein.
Doctors?
She fall asleep again.
Oh, new symptom. Interesting. She isn't aware of her sleeping episodes at all, which is also curious. This makes me think that she could be having seizures rather than mini sleeps. But if they were seizures, then I guess she wouldn't just be able to be woken out of them like she is. Anyways, rectal bleeding could indicate a rare neuroendocrine tumor that is secreting hormones to keep her awake. Could be carcinoid syndrome where they secrete serotonin, although that usually causes skin flushing, feeling hot, diarrhea, and rectal bleeding, most of which she doesn't have. It's a possibility. I would want to do blood tests with clotting, full blood count, and iron levels to check for anemia and blood malignancies. A colonoscopy now for sure. I would also definitely want to scan her head in case these are mini seizures due to encephalitis or some other kind of structural problem within the sleep centers of the brain. If the scan shows it's safe, then I will do a lumbar puncture straight after.
You have to sedate a patient to do a colonoscopy.
Why? Just because of the pain? If you find a tumor in her colon, you can knock her out. If you don't, she stays awake.
God, it hurts! She's bleeding.
Oh, to be honest, I don't know why she's finding this procedure so painful. Colonoscopy can be uncomfortable, but not screaming at the top of your lungs pain. Although, you know, it is a medical drama, they have to add a little bit of extra spice, I understand. So the reason why colonoscopy isn't usually that painful is because the distal third of your rectum is the only part of your colon that actually has somatic sensation, that can feel pain. The rest of it has a visceral innervation, which means the nerves don't really feel pain that much. In the UK, we usually sedate patients with gas and air or Internox, which is a similar thing as if you get a fracture and we need to put it back into place in A&E. So you can have as much or as little of the gas and air as you want. Now, the worst procedure for sure is the gastroscopy, where they go through the mouth. It's very uncomfortable and the patient is conscious as well. Anyway, seems like we've got new symptoms. She has a nosebleed, which wasn't there before. This lady seems to be bleeding from everywhere. When I was on ENT, we used to use a giant tampon to stop nosebleeds called a rapid rhino, which goes into the nose and gets inflated to stop the bleeding. You have to be a little bit careful though. If the bleed is from the front, it's no problem, but if it's from the back of the nose, your tampon may not go far back enough to be able to stop that bleeding there, and so you may think happy dandy, the nosebleed has stopped, and your patient is bleeding from the back of the throat. So we used to go and check our rapid rhino patients' mouths to make sure that there wasn't any blood running down the back of them after we put it in. And if there was, then we would need to use either a longer rapid rhino or try and advance the one that's already in there a little bit further, but not too far. We don't want someone swallowing a tampon.
Pathology from the rectal bleed showed traces of nasal epithelium.
So the butt bleed's just a nosebleed.
That much blood is not a just a anything.
It's gotta be a massive sinus hemorrhage that was draining down her throat and out the back.
The question isn't what, it's why.
Okay, great. Usually, I'm happy to let minor mistakes slide, but this is a monumental error. Blood which has gone through the digestive system does not come up as bright red blood like the one we saw that was coming from her rectum on her sheets. It is black, tarry, and foul smelling to the point where when I used to work on colorectal, I would go onto the ward and immediately know if someone had had this black tarry stool called melena, because you can smell it from a mile away. So no, it would not be from the nose, but let's assume it is. Move on with our lives so we can get more clues as to what's happening.
Rat poison mixed with some sort of neurogenic toxin could cause bleeding and sleep disturbances. Could also be some type of coagulopathy.
Or it could be us. Do you have any idea what it feels like to have a 6-foot-long hose shoved into your large intestine?
No, but I now have a much greater respect for whichever basketball player you dated in college.
Wow, House is fast with those insults. Rat poison actually kills the rats though through a type of blood thinner called brodaficum, which works in a similar way to the blood thinning medication known as warfarin. It blocks the action of vitamin K, which reduces the factors in the extrinsic part of the coagulation cascade 2, 7, 9, and 10, and therefore limiting the amount of blood that you can have clotting in the body. That can lead to excessive bleeding, but doesn't explain the staying awake though, which is why Foreman mentioned that it could be rat poison with a neurotoxin. I wonder if a neurological condition is causing sleep dysfunction and autonomic dysfunction, leading to a largely raised blood pressure and causing the nosebleed. It could also be vasculitis of some sort, although you would expect pulmonary hemorrhages at this point, and raised ESR/CRP on the blood test, which they would have checked. Let's see.
What if the poison ivy wasn't poison ivy? She got the rash that was diagnosed as poison ivy around the same time the insomnia started. Rash plus nosebleed plus sleep disturbance equals Wegener's Granulomatosis.
Ooh, that's a type of vasculitis. So I predicted that. Okay, that's not too bad. But the condition isn't called Wegener's Granulomatosis anymore. It's actually called granulomatosis with polyangiitis, because Wegener was a physician during the Second World War in the Nazi concentration camps and did his experiments on the prisoners that were there, and usually it's an honorary medicine to get a condition named after you, so they have been progressively stripping those honors from the Nazi doctors who discovered lots of conditions. GPA is when an antibody called anti-neutrophilic cytoplasmic antibody causes endothelial damage to the blood vessels. Usually it affects the kidneys and the lungs, leading to hematuria, fevers, joint pain, cough, weight loss, and coughing up blood. It can cause nosebleeds as well. It's usually diagnosed using blood tests for ANCA and a kidney biopsy. Treatment is with high-dose steroids to suppress the production of the antibodies. Our patient doesn't seem to have all of these or even many of these, so it's unlikely she has this, but let's see.
You're in acute liver failure. There's really nothing we can do to stop the toxins from building up in your bloodstream. Which means that in a few hours, you will lapse into a coma, and you won't wake up.
Wow, a lot has happened. So the patient was given a dog by her partner as a present, cheated on her partner, got a rash, blamed the rash on a dog allergy to cover up her cheating, and now has developed huge bruising and liver failure from whatever disease she has, which is not granulomatosis. Now, the partner that the patient was going to leave can either give half her liver to the patient or watch her die. Total madness. Liver failure is one of the worst conditions to have. It turns you yellow, makes you itchy, causes you to retain huge amounts of water in your abdomen, and can make you vomit up blood. One of the most common causes is drinking too much. So look after your livers, people. It is the only organ in the body that can also regenerate itself if you cut off half of it, but only if it's kept healthy. So make sure to do that. Drink responsibly.
If it's her liver, can't she get a transplant?
Well, it might give us an extra day or two, but pre-existing.
Hannah and I have the same blood type. Couldn't I be the donor?
Very lucky to have such a devoted partner.
Wow, House played her like Beethoven's sonata. The patient is very lucky here, as there are over 17,000 people in the US waiting for a liver transplant, and she just happens to get one just like that. The guilt trip on the patient at the end, though, was brutal, but understandable. It's amazing what people will do for each other when at the risk of losing their loved ones. This is why we're faced with horrible diagnoses. People sometimes turn to charlatans who are promising the world and delivering nothing but an empty bank account and a bad taste in your mouth. You can see though from this final shot that this patient doesn't really have liver failure. The whites of her eyes should be yellow, her skin would be more edematous, and she may even be drowsy due to buildup of toxic byproducts causing something called hepatic encephalopathy. You limit this by giving lactulose, so that helps the laxatives be passing lots of the toxins through the bowels and not into her brain. Anyways, it looks like she might be getting a new liver soon.
Like Wilson's disease, like cancer, love mushrooms. So do those tests and my tests at the same time. Use the PET to look for cancer and Wilson's while you endoscope her bile duct, scrape her stomach for mushroom spores. One of you CT her liver, while the other two check protein CA125.
Looks like they're doing a scatter shot approach to testing now. Wilson's disease is a congenital abnormality producing excess copper, liver failure, and rings around the eyes. Age of onset is usually between 5 and 35 years old. Cancer is cancer. Seems like they're testing for all cancers all at once, but CA125 is specifically for ovarian cancer. But they mentioned lymphoma and blood cancer as well. I wonder if it is going to be something else, though. It's so rapidly progressing, and neither of those conditions would progress that quickly. There must be something else, though. There are a limited number of things that can cause liver failure. They can be infective, metabolic, autoimmune, or because of toxins. Infective things are like cytomegalovirus, Epstein-Barr virus, hepatitis, which are all negative. Metabolic are like Wilson's and hemochromatosis, which is iron overload. Autoimmune has been ruled out since autoantibodies are negative. And toxins like alcohol or recreational drugs like shroom or medicines like antibiotics. Maybe she was taking an antibiotic for her sexually transmitted infection and then she got a reaction to it. I've seen a patient develop a liver failure just from taking flucloxacillin, which is a pretty normal antibiotic, not for sexually transmitted infections. To be fair, they did say at the beginning that she had ibuprofen for her knee, which she hurt skiing. How did she hurt that knee? Could that be another clue? Maybe she had a pituitary tumor pressing on her optic nerve that meant she couldn't see another skier coming, and that led to the crash. Although they would have picked that up from the scans already though. So yeah, let's find out.
We need to stop all the immunosuppressant drugs which are protecting your new liver.
But if you stop the drugs, I'll die.
You're dead anyway if we don't figure out what caused all this.
But since she's on immunosuppressants, the team say they can't trust the cancer tests, which is total hogwash because blood tests for cancer aren't that accurate anyway. If they really wanted to find cancer, they would just CT her from head to pelvis in addition to the bloods. It would be a ton of radiation, but would find pretty much all cancers and even a few incidental omas, as we call them. That's basically if you whole body scanned almost everyone on the planet, you would find 3 growths which are probably of no significance, would have never caused any problems in your life. So that's why this move to whole body MRIs is actually dangerous. You can get scans you don't need that lead to biopsies you don't need, which lead to surgery that's unnecessary and complications you should have never have got. Anyways, if they stop her immunosuppressions and she rejects the new liver, then it usually takes about a week to develop that rejection, although things tend to happen much faster on screen, so she may only have a few days to live. Seems like it could be cancer now. Let's find out.
Has the dog been traveling? Want to see a magic trick? Oh no! Where'd it go? Where'd it go? There it is. Oh.
What? That looks like the beginnings of a bubo. Don't tell me she had the bubonic plague from the dog. That is crazy. It's caused by a bacteria called Yersinia pestis that caused the 2nd largest pandemic known to man ever in history, has killed 1/3 of Europe's population, over 200 million people worldwide. It's transmitted from fleas which must have been living on the dog and has a reservoir in rats. Victims usually die within 12 hours of getting infected. They get sudden fevers and chills, and lumps in the armpit. It can be treated with gentamicin, quinolones if the diagnosis is elicited fast enough, although patients can still die even with treatment. Let's see.
Get that to the lab and call a CDC.
Tell them what?
That we have a patient with the plague.
The Black Plague?
Plague's carried by rodents, not dogs.
Where there's dogs, there's fleas.
Oh my god, we actually got it right. I don't think I could claim this before House though, since he did know to check the armpits. I was so close getting there. One day, people, I will beat him. Now give the woman some gent. Don't make her wait.
The steroids and the immunosuppressants acted like a big honking dam across the river. Physics 101, put a dam up in front of a raging river, the river rises. By stopping the immunosuppressants, we blew up the dam, and a 100-foot wall of bacteria flooded her lymph nodes.
100-foot wall of bacteria! The longest bacteria is 10 microns long, okay? And there are 30,000 microns in a foot. 3,000 bacteria would all have to line up to make just 1 foot. So then to make 100 feet, you've got 300,000 bacteria. Let's assume it's a tiny 1 foot wide wall. To be honest, that's more of an ornament than a wall, but let's go with it. Every foot wide you'd want to make it would be 900 million bacteria. There you go. Hashtag maths.
And fill her up to the eyeballs with streptomycin, sulfate, gentamicin, and tetracycline. Use a garden hose if we got one. Get yourself some prophylactic treatments as well.
I've got the plague.
Don't worry, it's treatable.
Okay, the antibiotic guidelines have changed a bit, but I have no idea why he's reassuring her, because there is actually a 30 to 60% mortality rate even with treatment. It's interesting though that a small proportion of patients with bubonic plague actually present with intractable insomnia. I still can't explain the liver failure unless it was ischemic from sepsis, but then you'd expect her to be more generally unwell than she was. And her kidneys would be shot as well. The plague does actually infect people still to this day in rural US and sub-Saharan Africa, which is crazy when you think about it. Damn rats.
She's been planning to leave me.
You knew, and you gave up half your liver anyway?
She can't leave me now.
You really want her to stay out of guilt? That's not gonna make either of you happy.
You don't know that.
Wow, these two girls totally deserve each other. One is happy to take a liver transplant from someone she wants to dump, and the other wants to give the liver so that she can guilt trip her partner into staying with her forever. The only victim here is their relationship therapist. Give that person a medal. But you know who else deserves a medal? You, for watching until the end of this video. Maybe we'll be a house in the next one. Go find out with another one here. Stay curious, stay awake.